Racism is an act of violence against First Nations, Métis, and Inuit peoples, negatively impacting their physical, emotional, and mental wellness. It is uncomfortable, but necessary to address racism in healthcare to start improving health outcomes for First Nations, Métis, Inuit peoples, and all Canadians.
It's important to understand that the CPR Racism Guide is intended to save lives as an immediate reaction to witnessed racism in real time, but in order to effectively address systemic racism, there will have to be changes in policy in all levels of practice.
Racism in healthcare is real and happens every day. RNs and NPs comprise the largest proportion of healthcare providers in the Saskatchewan health system and have the ability to eliminate racism in healthcare. RNs and NPs are to provide safe, competent, ethical care to all persons, regardless of a client's skin color, ethnicity, and/or cultural background. TRC Call 24 is now required for accreditation for the Canadian Association of Schools of Nursing and for program approval by the CRNS. Call 24 requires skill-based training in intercultural competency, conflict resolution, human rights, and anti-racism. With this requirement for new nursing graduates, additional practice support is required for all RNs and NPs to gain this knowledge and skill set. As a result, CRNS has developed an anti-racism guideline to reasonably assure all registrants are aware of these changes. The guideline has been approved by CRNS Council, and I will highlight a few key aspects. Guidelines are created to expand on practice expectations included in practice standards. When you read the guideline, you will notice that there is a large focus on Indigenous specific racism. This is purposeful. It is important to acknowledge racism towards Indigenous peoples because of the historic trauma related to colonization and residential schools. One act of racism has ripple effects. For example, a young Indigenous mom who has had a bad prenatal experience may stop going for prenatal checkups. That experience not only impacts the mom and her health, but also that of her baby. The role of nursing in Indian hospitals and residential schools has created lack of trust in healthcare.
And one of the things that struck me is many times through the years, my colleagues, nursing students, clinical instructors, they've said to me, we want to teach advocacy and we want to help our students be better prepared. And particularly when racism in healthcare, Indigenous specific racism was coming up, they're saying, so how do we do this? And so when that happened, I really started thinking about, the validity in their question. We do teach advocacy and all these things in nursing, but we don't often provide the opportunities for nursing students while they're in training to actually be supported, to be mentored, and even to be coached how to intervene when they witness perhaps unsafe care or care that may be racist. And so I selected the name CPR Racism as a way to underscore that peoples are losing their lives as a result of racism. And I know that we're working towards equitable care in Canada. It's very much a priority with Canadian Association of Schools of Nursing and certainly all regulatory boards. So I thought there's a gap. We have all this theory, we have growing knowledge about the impact of racism, and there's a lot more awareness of theory and practice of anti-racist education, looking at structures that perpetuate racism, in which we are indoctrinated and educated within. But one thing that is really lacking is a guide or a tool of what to do in the moment when you're witnessing care that is unsafe and potentially based on racism.
The guideline also includes frameworks that can be used to act when racism is witnessed. Responding to racism when you're witnessing it in the moment can be uncomfortable, as you may feel you don't have the competence or confidence to speak up. As with other skills in nursing, RNs and NPs need to learn practical skills to address racism. The CRNS is committed to supporting RNs and NPs to learn more about ensuring healthier healthcare environments for all peoples. To that end, we have created this video to walk you through the CPR Racism framework. Each of the letters within the CPR Racism acronym represent an action to be taken when witnessing racism in healthcare. The actions are not presented in a linear fashion, but rather capture key elements of an intervention. The first call-out action is C, call out. How can I help? This may be the moment or afterwards when you can have a private conversation.
It's really calling out, how can I help? And what that does is it situates the nurse now as targeting the behavior, not the person. It never works well to call someone racist in the moment. It's not the time. But then you become a part of the team, and then you can be part of what goes forward and provide assistance.
P, plan and practice your intervention strategy in advance. You're acting on this right now by viewing this video. You could also read the anti-racism guideline, discuss situations with a trusted peer, and role play to gain confidence in your response.
So we have to intellectually, mentally, emotionally, in our minds, make the decision that we're going to advocate and intervene. So we really have to have that mindset so that when it happens that we're ready to respond. And part of planning is preparing ourselves with how we're going to respond, reading literature, content, and doing some of the basics that I've talked about in this guide.
R, review the chart. Speak to and assess the client to effectively contribute to an appropriate treatment plan.
That also allows you to become a part of the team in the sense that you're now knowledgeable, you know what's going on, you've actually talked to the client, and you've done your own assessment. So that gives you basically the rationale to actually ask about current treatment plans and to be able to, what's the word I'm looking for, to be genuinely, authentically knowledgeable about what you're asking for and about what you're seeing, especially when you're pointing out discrepancies.
R, review the treatment plan in a respectful, neutral tone, request rationale from a colleague for the current treatment approach.
Now, I think this is sometime we're used to doing this as nursing students in our pre and post-clinical conferences. Like, we're asked, why are you doing this? Patient A, presents with X, Y, Z, and then we go prepare a plan, and then we come back. And we've done evidence-based lit reviews, and we're well prepared. Someone presents with COPD, we've done our background. So it's very much the same way. And then in thinking of it, it's really just saying, I've examined the person, I've reviewed the labs, and I've looked at the treatment with what we're doing, and it doesn't seem to align with what I'm reading over here. Can you help me understand the rationale? So it's that type of questioning of being respectful, collegial, but just taking that moment to pause and say, what are the treatment goals with our current strategy? And sometimes that can just be enough to reset, the dynamic of the interaction.
A, allyship and advocacy, and continuing efforts to educate yourself and your colleagues about becoming anti-racist. There are many resources available, some that will be available at the end of the video. Learning together with colleagues is a great strategy for taking the learning and creating an action plan that addresses both client-focused racism as well as racism directed at the members of the healthcare team.
That's learning about how we can better support all peoples who come from diversity. And it's really about educating ourselves and others. I am always educating myself in the process of doing that. And it's about becoming anti-racist as well, which involves action. It's beyond saying I'm not racist. It's about recognizing, naming it, calling it out, intervening, and then looking how we can change things.
C, check with the client and verbalize your position. Are you okay? I believe you. I am here if you need something. I will check back in with you. The goal is to become the safe person and to establish a therapeutic relationship. This can also apply to coworkers who may experience racism.
So you want to become the safe person, like, I'm here, I'll check back with you, is there something I can get you, are you okay? You know, those type of statements show that you're listening, that you're still their person. As the nurses, we're their safe person, right? Like when people talk about being in the hospital, say, my nurse, you know, it's kind of a possessive, you know, this is my person. It's really ensuring that this person knows that you're there for them, so that they have someone that they can perhaps express, you know, how they're feeling. So become that safe person.
I intervene by being an active bystander by using this guide. As you learn more and practice this step, will be easier to implement.
It's always do something. You know, we look at group mentality, we look at a lot of the study and research, and we know the more people there are, the less likely one person is going to stand out and do something because they think someone else will say something. And so this really is about intervene.
S. Speak up to your manager or educator regarding your concerns and seek support for yourself. This takes courage and finding support from a colleague or a mentor.
It's really about speaking up to your leadership about concerns. That could be the clinical nurse educator on your unit, it could be the team leader, it could be going up the chain of command, but really talking about some of the concerns you're seeing on the unit and to address it together as a unit. You know, there's more strength in numbers, and looking at ways, how can we change this together, you know, to make this a different environment. And part of that S2 of speaking up is also getting support for yourself. It's really important that you have a mentor, you have someone you can talk to, or even if it's just reading literature or blogs, and a way to support yourself in your journey of advocacy.
M. Model safe, competent, compassionate, ethical, trauma-informed care in all interactions.
And the M is what we end up with at the end. And I think for me, it's just in the end, if we don't know what to do and we're just not ready to advocate, perhaps there's a power differential. This is where we just model safe, competent, compassionate, ethical, trauma-informed care. And if we're doing that in all interactions, then that's going to mitigate any harm that may be coming as a result of racism.
As leaders, RNs and NPs can model how to intervene when racism is witnessed. The Anti-Racism Guideline, CPR Racism Guide, and this video are basic tools to gain the skills needed to take action. If you have questions or would like to discuss a situation, the Practice and Education Nursing Advisors are available at the email address on the screen.